and action. Hey, Brandon had a great question about growing pains, and I'm going to try to explain what happens with growing pains. What can happen if you take it to the next step and not listening to the ache, continue to overtrain, and cause a growth plate injury? There's two different things with that. Most growth plate injuries can be trauma-induced, but the majority of growing pains or joint pains in young people are non-traumatic. They're actually repetitive or overuse. So I drew this as a progression from short guy to taller guy to adolescent. So most of the time you'll have injuries that occur about 11 to 16 or so. That's when most of the growth spurts occur. And when you have a growth spurt, what physically happens is, we'll take this thing. This is the femur. This thigh bone, this is the heel bone down here, this is the tibia, or the leg bone. Now, when you grow, you're allowed to grow because this thing called the diaphysis, the shaft, is not connected to the epiphysis or head. There's a little bit of a growth plate. The growth plate allows the matrix to be formed, and it grows. The head obviously lifts past however long this diaphysis gets to be, until finally, as you're older, not in this one, in another one, you fuse the growth plate, it stops growing, and that's your height. So what usually happens is, I'm not sure if you can notice it, but the bone and the skin here is black, and this muscle here, the quad muscle in the front of the thigh, is blue. Hopefully you can see that. Here's a muscle, the calf muscle that goes into the heel bone down here. That's blue. So you can see as the bone lengthens, the muscle has to lengthen or else it's going to get too tight. So luckily, most of the people that are growing like weeds, they do grow, but they still grow at a not so painful rate. Otherwise, you'd have these guys complaining left and right, and they wouldn't be able to walk or play in gym class. So as you can see between this leg and this leg, the tibia grew, and the tibia's got its growth plate too. All long bones have their growth plates. Tibia's got its growth plate, the calcaneus or heel bone has its growth plate, the black line, and the femur has its growth plate, the black line. So it grew. Has this femur, this is what we're talking about, the femur. Femur grew, it increased your height, your leg length, your thigh length, and hopefully this quad muscle, quadriceps is four muscles that make up the front of the thigh. Now, hopefully the quad muscle also stretched a little bit and allowed growth. But as you'll know, if you see anybody with it, if you don't stretch or if you're excessively tight, you're going to have this tight muscle trying to keep up with the length of growth of this femur, and that tight muscle is going to pull down here on the tibia. And if you have somebody that is a couch potato and is growing, or they're not a couch potato, they're growing at a good rate, but they induce a lot of injury by weight training. Weight training with sloppy movement, doing a lot of proprioception, doing a lot of stair climbing, doing a lot of sprinting, wearing poor shoes. As one of my colleagues, Bob Weil, who took care of Evan Lysacek, he's a podiatric surgeon, and he took care of Evan Lysacek during his bid for the U.S. Olympics back in the Winter Olympics, and he won gold. But so what happens is when you lengthen, you hope that the muscle lengthens. If the muscle doesn't lengthen, it's going to tug on its insertion point. It originates up here and it inserts down here to the tibia. And if it tugs to the tibia, especially as you get older in this one, you can see that obviously the femur lengthened up into this kind of length, and the height of the individual is lengthened. And I drew this intentionally straight because I put the quad muscle as being very taut and inserting right here. And you can see the tibia here has its growth plate. Tibia here has its growth plate, but it's protruding a little bit. Tibia here has its typical Osgood Slaughter look growth plate that's pulling excessively. And because of the forces that are pulling, because of this growth, and because of the excessively tight quad, it's going to pull on that little bone there on the tibia and cause a little nodule. You actually feel a nodule. That's why I drew it here. You'll see the front of the knee as usual, but there's a little bump. And the bump is usually really tender. If you kneel or if you press on it, especially tender after training. Usually it doesn't have to be exactly at the time of training. It can be after a day or two. During overuse, if it continues and you don't listen and you overtrain, it'll be painful even before you start training. So that's when it's advanced. That's when you really have to be seeing an orthopedic surgeon or a sports medicine a person like me. So this is excessively tender. They can also, in the calf muscle, cause pulling and Sever's disease, or as Dr. Weil says, Sever's syndrome. But it'll pull on the heel and cause excessive heel pain down here. Same thing. This is calcaneal apophysitis. That means irritation at the apophysis of the calcaneal bone. This is tibial apophysitis. Now again, it's the irritation at the insertion of the bone or the muscle onto the bone at the apophysis. Now, what happens is usually when you have the bone grow, this is just like my illustration. You'll have your bone that grows, that's represented by black. Let me just fix this. Represented by black. And you'll have your muscle that kind of tries to keep up. So as this bone grows, muscle gets taut. Eventually, that's what happens. It doesn't really snap, but eventually it's going to be under great pressure, and it's going to pull excessively on this insertion point down here. So unless you stop growing, and then, or unless you work on flexibility and get this before you start growing or while you're growing, if you work on excessive flexibility so this muscle is loose, it'll tolerate the growth. It'll tolerate the growth. Now you're not gonna have a loose muscle like that. That's floppy. But if there's flexibility in it or a little bit of give, it'll go with the growth. But that, as my sprinters know, and if you've ever seen the NBA guys warming up, just sitting in one position, in a flexed position at one joint, and just breathing, or having somebody lean on them, the trainers, that's because they're trying to get the muscle to loosen. There's something called a TREP effect, that before performance, before your exercise, if you work on physiologically stretching the muscle, it performs better. It's an old concept, but I still believe in it. And I know there are some coaches that don't warm up their students or their athletes. I say no, you have to warm up. And that's, obviously I'm a yoga instructor, and I believe in flexibility. And I think that if you work on flexibility, the chances of injury, whether it's an injury on the court, injury on the turf, injury on skates, doesn't matter. There is less chances for the injury when you have pliability and when you have proper training, proper shoes, proper coaching. All this is involved, but for the sake of growth plate injuries or growing pains, I just mentioned two of them. Sever's syndrome or Osgood-Schlatter disease. Calcaneal apophysitis, tibial apophysitis. There's also, I didn't draw it here, but also happens in elbows with little leagues. Elbow here can cause pain, little league elbow, or medial epicondylitis, medial apophysitis. You know what? I'm messing that up. But little league elbow, little league shoulder, both cases, especially when you're throwing heat or you're teaching little guys to throw heat. And that's why we always, even with before they get in the little league, you just have them play t-ball, because you can't be having one of the other kids, the pitchers, throw with growth plates that are still very delicate. The tendency is to throw fast if you're a pitcher. You're always going to want to strike out for the crowd sound and the applause from the crowd, and you'll wind up having an injury. So. Same thing with overtraining. Sometimes you'll have coaches that are overzealous, or you'll have athletes, student athletes that are overzealous, and they'll train too much, not do enough flexibility exercises, or just kind of go into unmonitored pain. And sometimes when you have a little pain and ache, it's expected, take some Tylenol, you'll be fine. But there's a fine line between a little bit of an ache that you get from regular exercise and growth plate injury and or growing pains. So growing pains are a colloquial term. It's more from outside the office. In the medical community, we have apophysitis and or irritation with tissue breakdown at that insertion point, if you want to talk about it histologically. But bottom line is that it's a good question, because there's a fine line about Do we get our athletes, our young athletes, to lift weights, to do resistance training, to do plyometrics? And I think it would be helpful, monitored by somebody who has knowledge. I would usually say, coach is fine, but parents, you got to really research the coaches. Or you got to hire somebody of a physical therapist, a life coach, a personal trainer, somebody who's a strength coach, somebody who has extra training. I like the credentials, or the fact that some certifications have to go through the American College of Sports Medicine. I used to be on the committee that gave fellowship or research awards to the sports medicine community, or the young guys coming up, and it's very strict. So that at least is a body that tries to get a general certification for people trying to get into the field. You don't have to have that shingle, but if you look for it, I think it'd be important. If you're unsure, go see your orthopedic surgeon. Hopefully the orthopedic surgeon does sports medicine. I like my sports medicine trained orthopedic surgeons, my young guys, out of teaching hospitals, hopefully, or primary care sports medicine trained doctor. In primary care, you can go in as a family practitioner or an internal medicine doctor to take extra training for a certificate of added qualification. It's an extra year. That's why I did my World Cup training, and I worked for the Chicago Marathon, and I did a couple other things with martial arts. But I did that before going into integrative medicine, so it's always my love of taking care of athletes. You can also do PMR, or you can find somebody that's trained in physical medicine and rehabilitation, a physiatrist, and sometimes they go into a fellowship in sports medicine. But bottom line is that you should seek out, if you have young people that are athletes, or at national level, state level, or you think they have potential, go with your coach, spend the extra money to see the specialized trainer, or go to the best trainer in the area. But also, it wouldn't hurt to seek out the second opinion from one of us, as far as MDs and or a physical therapist trained specifically with sports medicine, trained specifically with the field that your student is in. So, good question, Brandon. As far as inflammation control, well, you always work with flexibility first. That's why I think if we're going to introduce our young people into any form of resistance training, plyometrics, strength training, it's important, agility training as well, it's important to first learn flexibility. It doesn't have to be flexibility from a yoga instructor, but it should be a flexibility routine that's adopted and followed through at least every day. Hamstrings especially, calves. In yoga, the calves and the hamstrings, those flexors, have a very possessive personality. Anybody that's a runner will know that if you let go of stretching for one day, the quads, they do okay. You can get the flexibility back when you start stretching them again, but the hamstrings are terrible. They have this resiliency that if you miss one day of stretching, they're back to being super tight. And thus the reason for more hamstring strains or sprains than quad sprains. So pulling a hammy is, I mean, you can feel it, you'll get by, but having this thing where you have apophysitis or growth plate injuries, or just that growing pain, that can lead to catastrophe down the line. So first work on flexibility, then work on proper technique, then work on proper equipment. Get the guidance of a specialist, and hopefully get by. Anti-inflammatories, depending on the age, are okay. If it's children below the age of 16, even if they're huge, like some of these monsters I see going into high school, you still have to be careful about the liver. So Advil, children's Advil, go for max dose, 100 to 200 milligrams, 3 times a day, and that's it. Sometimes you can paint on essential oils, like I love Panaway. That's helichrysum. It got me through 2 marathons without even training, and I think it's helpful. Magnesium, you got to make sure that's well maximized. But again, with a kid, you can't give too many supplements without side effects. And then sometimes using straps would be helpful. What a strap does, like a show patch strap, it temporarily, or taping, dynamic taping, it'll temporarily help, but you still have to work on those basics I just mentioned. Show patch straps go across the knee. Sometimes you can get the same when you strap on, or you get a medial epicondyle or a forearm strap. Again, you can throw past that, you can run past these things, so it's not just putting on the strap and saying you're fine. You really have to use that as a temporary measure until you get into therapy, until you can get somebody to teach you proper technique and slow down a bit. If you get into the point where it's painful even during rest, that's it. You have to be off at least for a week to 2 weeks. at least a week at a time, anti-inflammatories, ice or cryotherapy, sometimes electricity. It depends on the physical therapist and where the injury is. Deep tissue massage, stretching from a massage therapist, always helpful to get this thing sped up. And that's the problem, and this is why we always end up getting growing pains going into growth plate injuries, is because our seasons are so competitive and they're so short. So you're trying to get somebody into preseason conditioning so that they can get into season with flexibility and hopefully have less chances for injury. And when you have multiple sports that you finish one sport and you go into the next sport, the training you did for your first sport not be exactly the same kind of flexibility and preseason conditioning for your second sport. So technically you're going in cold. That's a higher chance of injury. Again,